The percentage is shifting more and more towards wearable just because it's convenient, it's more comfortable for patients. And I can foresee in the future where it'll be almost 100%, or it will be 100%. My name is James Murphy. I am an ophthalmologist and glaucoma specialist. I was looking for how to address the issue during COVID of not being able to have patients indoors. What are some available options? And I asked some colleagues through the American Glaucoma Society, and some of them mentioned doing a wearable headset. The reason why Carrot was not just like a one-time COVID solution, one of the reasons was because patients preferred it.
I was diagnosed with glaucoma in my very early 40s, and I needed somebody who was going to be up on all of the latest technology. I did some research on Dr. Murphy, and I was highly impressed.
So when we actually have patients come in and we tell them that we're going to get some baselines on the Carrot device, a lot of them are very excited.
This is a test they're going to have to take 2, 3, 4 times a year for, who knows, could be decades. Having that just more comfort, feeling a little bit more confident.
Working with the Humphrey was certainly time, the time was huge, and how can we make, this workflow more efficient? And, fields were kind of taking up a lot of time on the Humphrey because, some patients, really needed a lot of hand-holding.
It wasn't as heavy as I expected it to be. It was quite comfortable. I feel it really changed everything. It was so much faster.
At every American Glaucoma Society annual meeting and every forum, I get the question, well, how comparable are these? The results are very similar and very valid, and the results have been validated. If you have 20 years of traditional field tests, 15 of those years don't matter. Doing a rebaselining for those patients, it's very much, to me, completely organic because they're going to continue coming in every 3 to 6 months. You can use those visits to rebaseline them. Recency is the most important thing.
When I first started working with the Carrot device, I was absolutely amazed by the fact that we didn't have to use trial lenses. That you just, put the prescription in and it did everything for you.
The biggest cost to any practice is manpower.
With the Carrot device, we've noticed that it's certainly made things a little bit easier. When we start a test, we can kind of go into the other room and do something else while that test is running. It's definitely added a little bit more efficiency to the practice.
From a workflow perspective, from a business perspective, and from a purely clinical perspective, the standards change.